Contrary to common belief, colorectal cancer is not exclusive to older populations. Recent studies have shown that diagnoses in younger adults has doubled over the past 30 years.
Yeah, so what signs should you be looking out for as indicators of maybe something more than just a gut issue that can be treated at home? Well, Dr. Thomas Riley, he's a gastroenterologist at the University of Michigan Health West, joining us this morning to share some vital information. Good morning, doctor.
Yes, good morning.
Thank you for being here. We think about, we were just discussing off air, when you hear colorectal cancer, the first thing you think of is an elderly person, but that's really not so much the case.
That's a myth. You know, certainly the diagnosis of colon cancer is being made in younger patients. And in fact, over the past 30 years, we've seen a dramatic rise in the incidence of colon cancer in patients younger than the age of 55.
Okay, so, I guess we should define what younger means in this instance.
As young as 20.
Mm-hmm. Wow,
yes.
As young as 20?
Yeah, so approximately 20% of colon cancers are diagnosed in patients below the age of 55.
Mm-hmm. Right.
So,
and that was kind of where you were going to start getting colonoscopies, and so they've kind of lowered the standards here now.
Yeah, so the guideline now for average risk people is to start screening at the age of 45. That's the new standard for average risk. Mm-hmm. And in fact, you should start earlier if you have a family history of colon cancer.
Okay. Mm-hmm. And this is for both men and women?
Both men and women. So another myth is that men are at higher risk of colon cancer when in fact it's almost equal between sexes.
Okay.
Yes, absolutely. So men and women need to get screened.
Huh. Interesting.
That is surprising because, again, I typically think older gentlemen. Colorectal cancer.
Nope.
But that is not
men and women.
The numbers. So we're at home. What type of symptoms should we be looking? Like,
you know, certainly be aware of any change in bowel habits. Blood in the stool is a red flag. Nuance at constipation, belly pain that's unusual, weight loss. You know, so just don't ignore those symptoms. Let your primary care doctor know that you're having these symptoms so you can get evaluated as soon as possible.
Right, and that's particularly true for these younger patients who are not getting screenings. Mm-hmm. A lot of them are, though, ignoring the symptoms. Talk about the repercussions of doing that and why you think people are just kind of letting it go.
You know, fortunately, colon cancer is treatable at an early stage, and the prognosis is actually fairly good when it's diagnosed early. You know, patients often assume that bleeding is something simple like a hemorrhoid, and it goes on for years before it's diagnosed at a young age, unfortunately. So that's really a mistake.
Oh my goodness. Yeah, I can imagine letting that go for years. Are there ways that people can change their lifestyle to prevent colorectal cancer?
Absolutely. So we know that sedentary lifestyles put you at higher risk for several cancers, including colorectal cancer. You know, diets that are high in processed food, red meats, put you at higher risk. Tobacco, heavy alcohol use. So modifying those risk factors certainly will reduce your risk of getting colon cancer.
And would you attribute those lifestyle factors to the big increase in people younger getting colorectal cancer?
Some of it. Okay. Some of it is environmental. Some of it is genetic. So it's a combination of things.
As soon as you said that, I thought about that's keen insight because the screen time has increased so much for this younger generation. It's that sedentary lifestyle that you're talking about, not being out and active. So we mentioned that early detection is always key, right? Early detection for any type of cancer. You said 45, unless your family has a history. If your family has a history of that, how early should you be starting? You
know, perhaps in your 30s. It just depends on the family history. Okay. You know, again, talk to your doctor. Some patients have to start in their 20s getting screened if you have a very strong family history.
Okay. So this truly has a genetic component to it.
It can, absolutely.
Right. And I think the key here is just making sure you have open communication with your general practitioner, right? And make sure, because they're the one who's going to have to order that colonoscopy for you. Okay. Any other advice for people this morning?
You know, I think that, colon cancer, there's several ways to screen for colon cancer. I want to put that out there. So colonoscopy is not the only way, even though we as gastroenterologists consider that to be the gold standard. It is the best test for most patients to get screened. There are other ways to screen for colon cancer. And I want to just push the fact that any screening is better than no screening. And in our population, up to 30% of patients don't get any screening, which is really sad.
Oh my goodness. You said 1 in 3? 1 in 3 don't get any. Oh my goodness! So this is obviously an important test, an important screening to take care of, and our younger generation is seeing an uptick in this disease. So let's make sure that we're taking care of this. UofMHealthWest.org. If you want any more information, maybe just start, as you heard Michelle say, start with your primary care physician and start that conversation. If you have any questions, you can always call that number on your screen. We'll be right back.